I'm excited. It's been a bit since we've done a live, so
Mhm.
I'm excited for another delectable conversation here.
Me
This
too.
time on Western medicine, which I was telling Phoebe, I feel very strongly about like addiction and things like that, as you know, and
Mm.
I think I have strong views. I'm not against Western medicine by any means. I use it, if I'm getting surgery or something, if I have menstrual cramps, I'm taking an Advil. So
Right.
I'm not one of those people who's like, I'm very much against Western medicine, but I think we have become a society that relies so much on a symptom-based approach to treatment
Hmm.
that we forget the underlying factors of, more emotional stuff and traumas that somebody's dealing with rather than just putting a band-aid on it. So I know you have your share of experiences as well.
Hmm.
Um, Same with me, or I've known people that have been kind of put through the ringer. And I think right now we've become a society of just there's a lot of people in pain.
Hmm.
I mean, look around you and we have, especially here in the US, I mean, we have all these pharmaceutical companies and we have so much money rolling in. We have so many treatments and modalities in the Western world. But when you look at the overarching community, it's still majority of people are in pain of some sort, or they're unhappy, or they have the mental illness, anxiety, depression is rampant right now. And you have to ask yourself why. What
Hmm.
is the reason for that? Are we doing something wrong? Should we be shifting in a different direction? And, having worked in holistic medicine for many years, it's eye-opening and it makes you view things in a different light. And it's like, where did we steer and down a different path? Where thousands of years ago they used more natural modalities to treat, and then once pharmaceuticals were developed in Western medicine um, and allopathic medicine, it's we've become the quick fix society. It's like, oh, it can
Hmm.
instantly cure my disease, but are you really curing it? You're not really curing it. You're just putting, again, the band-aid on it.
Yeah. And insurance companies, well, for the people who are lucky enough to have insurance, they make it really difficult for people to explore something that's not chemical. So, for example, if I
Yes.
went to the doctor and I said I was feeling depressed or anxious, I could probably get psychotropic drugs for, I don't know, $20 under my plan.
Right.
But if I want to see a therapist, it's almost $200 just per session.
Yeah,
So
exactly.
if you at least you're starting out, you want to talk to the therapist at least a couple times a month. That's $400 in the hole. They make it really difficult for people to do something that's not popping a pill. And I've seen a lot of people in my life who are feeling depressed or anxious for a sustained period of time. I'm like, okay, I think it's time for me to get meds. But they aren't thinking about the long term, right? Because even if you go to the doctor, you get the prescription, they say, well, you can't just use the meds forever. It should be supplemented by
Hmm.
therapy. And people, they get the quick fix and
Yeah.
they do it for as long as they can. And then I think at least in some cases, the prescription runs out unless you start seeing a therapist. So
Hmm.
I kind of feel like um, Western medicine puts the cart before the horse. They
Right.
are very quick to throw these medications at people, but then they say, oh, okay, well, feel those benefits for a few months, but by the way, you're either not going to be able to get these for as long as you want, or you're just going to have to, or you have to drop everything altogether because you can't afford therapy. It
Right.
doesn't make sense to me.
Yeah, and the fact that you have side effects and things like
Hmm.
that, it becomes this spiral, I guess, or this pattern where, and I've seen this in my own family. I'll give you an example. Like my my grandfather, who he was in his mid 90s, or he had what he had. He had like a stent, or it was like a trial thing he had. What's it called? I forget. Some sort of stent, like put in his heart, and like a valve put
Okay.
in, and it was like a new treatment. And the fact that he was so healthy at that age,
Hmm.
because this was a guy who never took a drug in his life until his mid 90s, like was all about eating well and exercising and taking care of himself
Mm-hmm.
and staying grounded. So he had that, you know, the mentality as well, not
Mm-hmm.
just the lifestyle. But, you know, it wasn't until after he had that surgery, he had to go on, I think it was some sort of blood thinner, some sort of medication.
Mm-hmm.
From there, it debilitated him, you know. And I'm
Mm-hmm.
not saying that, again, drugs are bad, but I'm just saying I observed the, you know, somebody who's very healthy going into his mid 90s, which is not an easy thing to do these days, to
Mm-hmm.
taking one thing, which led to having to take something else and something else and something else, because now it was affecting different systems of his body. It was affecting, you know, it was affecting his mood. You know, he was
Mm-hmm.
tired. You know, he couldn't do much. He couldn't even walk to around the block, you know, like he used to. So, you know, that's an extreme example of somebody who's a lot older, but I see this, there are a lot of people, you know, start on one medication and then, you know, you're taking medication for the side effects of that medication and other side effects. I mean, working in acupuncture, I've treated people who've given me their medication list, and it's like 3 pages long.
Oh my God.
And here I am, I'm not taking any medication. And I'm like, wow, you know, and it's like, how do you even find the pattern out of all of that? Because it's like a lot of digging, and it's like, how do you get to the root? Because there's all side effects, and it's almost like looking out a window that is completely fogged and blurry or has like dirt all over it. You know, it's hard to
Mm-hmm.
see through. So, you know, for a lot of people, you know, using something like pills as a first choice rather than a last resort, you know,
Right.
rather than trying to lose weight naturally through or changing your diet or shifting your lifestyle or
Mm-hmm.
doing something like a spiritual practice where you can, you know, be in a better mindset for your anxiety or depression symptoms rather than just popping like a Xanax. Um, you know, it's become backwards, I
Yeah,
think,
I completely
because
agree.
you know, like I said, you just get in this mode, and then it's from there you kind of lose who you are as a person, you
Mm-hmm.
know, and then it's hard to track what you're actually feeling because you're always numbing, you're always putting that band-aid on, so
Mm-hmm.
it's you can't actually feel in your body if you're always numbing. That's all I wanted to say. Yeah.
No, I think that's absolutely true. And I think, I mean, I'm thinking in the case of your grandfather, right? I mean, I'm not saying this happened in his case, but I think doctors are really quick to pass the least labor intensive thing onto the elderly. So I remember when my grandmother was having difficulty swallowing, this was years ago, and it turned out it was lung cancer that was causing this symptom, which I later found out is a classic sign of lung cancer when you can't
Hmm.
swallow. So she went to the doctor, and one of their first treatments was antidepressants because they figure, well, we don't really want to do a lot of investigation and testing into this person. You know, they're already in their 80s, got other stuff
Right.
to do. I mean, I'm not saying this is the way all doctors think, but in this particular case, you know, if you are a person who's in their 70s, 80s, and beyond, I think you do run more of a risk of getting dismissed.
Hmm.
And
Yeah.
again, you
It's
know,
the old age prejudice, I call it.
yeah,
The
no, exactly.
geriatric prejudice. Yeah.
Absolutely, absolutely. Because I think they figure, oh, well, you know, what are we really going to do to improve this person's quality of life? Just kind of
Hmm.
send them away with new pills, see what sticks. And it was this huge trial and error process before they ultimately did say she had a lung mass, which was when she was in hospice anyway. So
Mm.
I'm not saying she could have bought a lot more time by getting the diagnosis earlier, but I did just think it was really interesting that she was on antidepressants so early when it had nothing to do with a mental illness
Right.
disorder.
Right. Exactly. Yeah. Yeah. It's that's why I always say, not knocking psychiatrists, but I always say go to a psychologist over a psychiatrist because then you could at least talk it out and, you know,
Mm-hmm.
get some kind of healing from that rather than somebody who specializes in giving pills
Yeah.
to treat your issue. And,
Mm-hmm.
you know, there are people with don't get me wrong, there's people with serious chronic depression and anxiety, and drugs help them
Hmm.
immensely, because some people can't even walk outside the door, they can't even get up out of bed. So
Yep.
it's an aid to help them get over that. But I think when it becomes where they just always are remaining a victim, and they're always in that place for themselves, like, I am a depressed person, I have anxiety, I am fitting myself into this box, therefore I'm always needing this pill, or I need to rely on this thing to help me, to fix me, then they
Hmm.
can never heal themselves enough to maybe taper off of it someday, or
Hmm.
or they never even try to do that. You know what I mean? It's just become where you're reliant on these certain substances, and it becomes an issue
Hmm.
where it's now affecting your whole system.
Absolutely. And
Yeah.
that, I think that goes back to the way the systems failed people in a way, because I think if you're going to be in a position of authority to hand people drugs, there should be more of an emphasis on supplementing this with really exploring why you want these drugs. And like you said, there are people who absolutely should be on them long term for chemical
Hmm.
imbalances and other ailments, but I think there's so much benefit that people could take from more, holistic therapy or talk therapy, and they're
Or at
just
least implement that into your current regimen.
exactly.
So people don't even do that because they dismiss it, or in
Mhm.
the Western world, it's looked as more, it's not scientifically based or backed,
Yep.
so something like an energy medicine, they're not
Mhm.
going to even explore. They may have it as, like, I was giving an example earlier of working in a drug alcohol detox center doing acupuncture. It
Mhm.
was more like a complementary therapy.
Mhm.
It was more for like the luxury detox facility, rather than actually something that can help somebody immensely in their
Mhm.
healing process.
Mhm.
So it's how it's all about education. So it's all about educating the patient on what is, not only side effects, or what other things are out there that you can use in addition to a pill. But I
Mhm.
feel like doctors and stuff are so busy, and they see so many patients, that they lose that connection, or that ability to really educate a patient. And some doctors over others are great at educating, and but there are ones that are just, it's kind of like this run of the mill factory, where
Mhm.
people are coming in and coming out, and people are satisfied because they're getting something that they think is going to fix them.
Right. Exactly.
So it's a shift in our mindset, and I don't know how, we've gotten much better over the years,
Mhm.
kind of getting back to a more integrative approach, but I don't know how long it's going to be before we really kind of wake up and say, what we're doing is not necessarily working,
Mhm.
because doing only this and forgetting about the other components to a person, only treating the symptom but never getting to the root cause of something,
Right.
that
Right.
becomes an issue. And then it becomes somebody who can't heal from trauma because they're just, they're not actually doing anything about it. They're just numbing it out.
Exactly. Because I mean, it's very enticing. If you can just take a pill real quick
Oh
and
yeah, hell
feel
yeah.
that relief, then it's like, why bother?
Exactly. It's like losing weight, right? If I'm gonna just like, I was laughing. I was looking in what I get in the mail, the Sharper
Yeah.
Image
Catalogs.
magazines.
Uh-huh.
Yeah, where they have all those the weird, like, crazy expensive, like, I don't know, it's weird things. So they had one of those back in the day, women wore the waist belts that helped them lose weight. It would just like
Yeah.
vibrate.
Yep.
And now they do, like, what is it, cryogenic, where they freeze like the fat cells or whatever.
Oh yeah.
Or
Oh,
what is it called?
she joined and Chris. Oh yeah. The is it cryogenic where you
Something
sit
like
in that?
that.
It's like a vat, and they run the cold air around your torso to
Something like
freeze the
that. Yeah.
fat cells.
So I was looking in the magazine. It was funny because it was like the old school waist belt, but it was like the cryogenic, and you look at the ads for the women, it's all like, you got some like what is it called? The epilator thing pulls out your hair or whatever. But yeah, it was like the weight loss and but like the instantaneous thing. So I just thought it was funny. And then they had like a bodysuit sauna, which was kind of funny too. But anyway, but that's what I mean, it's like marketing and how, I don't know, how we think. So thank you everybody for joining. Just wave here, a couple people who joined. If you guys just joined, we're talking about a little bit about Western medicine and how it's kind of affects our mindset in being more of an impulsive society and how we rely on quick fixes and pills. And like I was just bringing up, weight loss, how we're looking for like quick weight loss rather than putting work into something. And that's where I think, something like holistic medicine, alternative medicine, people don't want to stick with it because it takes longer.
Mm-hmm.
I would always tell people, the more chronic something is within you, the longer it may take to treat.
Right.
And people don't necessarily like to hear that because the mindset is still in that, I want it now type of mode.
Mm-hmm.
Yeah.
And also, I think I've seen my friend Cheese on it, and Easy Being Cheesy. This is good timing because he and I were just talking about olfactory training. So we talked
Okay.
about COVID-19 symptoms and how a common one is loss of taste and smell. So
Yep.
we were reading about, of course, non-FDA approved ways of treatment, because there's still so much research that needs to be done into these symptoms and what's an approved treatment for it. So we read that if you have a certain group of essential oils, I don't remember all of them, but I think it's rose and clove were two of them,
Mm-hmm.
and you smell them for however many minutes a week, it can help to retrain
The senses.
I think the
Cool.
neurons to
Yeah.
recognize the smells, and it kind of helps you rebuild the wiring, so to speak.
Yeah.
So I sent this to a couple family members, and they immediately were like, no, that's dangerous. My mom said something about liver damage. I don't know where she got that from.
And pills don't give you liver damage. Yeah.
Right, exactly.
Wow.
Because
Yeah.
it's not FDA approved, because this
Right.
isn't my doctor telling me this, then they
Right.
immediately say this is snake oil, it's a scam.
Yeah. Well, you know what else it is? It's because there's extremes of the two sides.
Mhm.
You know, there's no, like, you have to find that balance in the middle. So something like essential oils. I use essential oils. I have a ton of them.
Mhm.
Use them every single day. I find them helpful more so for like emotional meditation stuff.
Mhm.
But at the same time, if I got coronavirus or something, and people may not agree with me, I'm gonna probably go to a Western doctor because I
Mhm.
don't know enough about it. I don't know treatment for something like that.
Mhm.
So, there's people on the far one side who are like, anti everything having to do with Western medicine. Like, I'm not going to
Mhm.
take any medication, no vaccines, nothing. And I'm
Mhm.
just going to, meditate and sniff my oils and hold crystals, and I'm going to heal myself. And then
Right.
you have people on this side who see those people and they're like, anything, whenever they hear, the brain, whenever they hear essential oil or they hear like crystal or they hear acupuncture or they hear energy medicine, energy,
Mhm.
they're like, no,
Yeah,
So you have the two sides battling, and there's no, like, there's this whole middle gray area
exactly.
that that people forget about. Like, you don't
Mhm.
have to be one side or the other, you can have both. And that's a
Yes.
thing, like, especially social media. It's like, okay, you're a spiritual person, therefore you can't believe in vaccines, you can't believe in Western medicine, you can't believe, you know what I mean? There
Mhm.
becomes this, I don't know, overarching, like, message that people are sending,
Mhm.
and I don't think that's right, because you have to do what's right for you, what you feel is right for you,
Mhm.
and yeah,
Yeah, I mean, I love
that's how I
science.
feel about it.
I
Like,
have so much respect for doctors. I am totally in your camp, where if I have certain problems, I'm running right to Western medicine, because I trust them to be able to diagnose and treat, but like you said, not in all cases. I mean, if
right.
I don't subscribe to the whole, oh, I think I have the flu. I'm going to run right to the doctor so I can get a Z-Pack. I think we talked about that before. You know, there's a
Yeah.
lot of, we'll prescribe you an antibiotic for a viral problem just so the patient can walk out with something, just like you're saying.
Yeah.
You don't want to leave empty-handed, because then that means you failed, which is, I think
Yeah.
that's a dangerous way to go. You know,
Yeah.
sometimes trying other things or just doing nothing is fine. Like
Right.
with fever reduction, for example, my family's
With
always
what
been, oh, you
reduction?
have fever? Fever
With what?
reduction? This is,
Oh, fever reduction.
yeah, this isn't about like the high fevers from COVID or anything. This is like in a pre-COVID world. You know, I'd get sick. I'd have like 101 fever. Oh, you have to take Tylenol for that. I'm like, nah, that's okay, because that's like your system's way of fighting the infection. You don't always
Right.
have to reduce it, just when it gets to a dangerous level.
Right.
But
Right.
I think it's
Exactly.
always been ingrained, like if there's something that's not normal, even if it's totally manageable by doing nothing or resting, just take medicine for it or see a doctor for it.
Right. Exactly. Like our parents' generation and stuff. It's like, oh,
Mm-hmm.
like you have a cold? Oh my God, here. No, like my body's gonna fight it. Like my immune system, okay, some people their immune system may not be strong and maybe they do need something, but my immune system is I'm healthy, so knock on
Yeah,
wood, but
right.
I'm pretty confident that my body can fight something like the sniffles or a cold. But again, yeah, if my temperature is 105 and
Yeah,
then I'm probably going to resort to a doctor or Tylenol or something to get the fever down to a
right.
safer level where I can function. But yeah, it's funny when you think about it.
Mm-hmm.
Yeah.
But you have a good point, though. It is important to be inclusive. I'm certainly not talking about like immunocompromised, because that's totally different. They need to manage symptoms in a totally different way. Like, I'm super grateful to have to not be immunocompromised, where I can have those things progress on their own and it's not
Right.
dangerous. But
Yeah.
there's a lot of people with robust immune systems that are like, oh yeah, my congestion, I'm gonna go to the doctor.
Your body is giving you symptoms because it's fighting something. It's fighting
Right.
something. So you have to give
Yeah.
it a chance to fight it. I mean, if it lingers on for weeks and weeks and weeks, okay. But if it's been, one day and you're like, oh my God, like I don't feel so good, like let your body rest, don't push
Yeah.
through it. Let your body rest. And Vivi says people here in Greece are obsessed with antibiotics. Here
Really?
too. And yeah, that's the other thing. It's like chronic antibiotic use,
Mm-hmm.
just depleting everything, in
Mm-hmm.
your body. So,
Yeah.
at least take a probiotic if you're going to do antibiotics because you're
Mm-hmm.
just depleting all the healthy bacteria in your gut and you're basically depleting your immune system the more
Right.
antibiotics. Yeah, it's gonna kill whatever you got going on, but it's gonna kill all the healthy stuff too, and you're gonna be
Right.
weaker from it. And this is an issue that I see a lot with, again, I saw with like my grandparents and stuff with older people.
Mm-hmm.
They feed them antibiotics because they're really afraid that they're going to, catch something in the hospital or they want to be on the safe side. But
Mm-hmm.
it's like at the same time, you're just depleting your immune system.
Yep.
And I have a funny story actually of a doctor I went to many years ago, and I had some kind of rash on my arm. I didn't know what it was, like a rash, and I went to the doctor, and after he like yawned in my face, first of all, I was like,
Good start.
he looked at it and he was like, I don't know what that is, and I was like, I think I need an antibiotic, and he was like, all right, and just like wrote me a script for antibiotic. I didn't know what it was. He didn't know what it was. I'm not a doctor, so I don't know. That's
Oh my
just a little
God.
tidbit there.
It's kind of like McDonald's, right? You just go, can I get an
Would you like a
antibiotic?
flu shot with that? That's what they ask you now.
Yeah.
But
How
yeah,
about
and it's I don't know, like holistic medicine and stuff is coming more into the mainstream, but it's being integrated here, but it's still like I worked in a doctor's office for many years and I was kind of like I felt like the outcast, I felt like the
right?
outcast. I was
Yeah.
the only one doing like acupuncture, and
Hmm.
and meanwhile, if you have doctors who are shooting people with like cortisol, or cortisone, whatever, for pain relief and stuff like that. You know, it's being integrated, but they're losing the more spiritual side of something like energy medicine in the process. You know, I'll bring up acupuncture, right? It's become where there's a lot of acupuncturists who are working in medical facilities and Western facilities. There's even physical therapists doing it. It take like a 2-week training course, or not even like a weekend training course, and they're sticking needles in people, which is crazy because you're losing the whole gist of the whole medicine. So you're saying, okay, you have pain here, so I'm just going to put a needle here. No, that's not how it works. There's a lot more to it. So they lose the woo-woo aspect of it, right? The more spiritual side, which is, I feel in my heart, what people need the most. The more emotional component, right? To really delve into who somebody is rather than just sticking them with needles, or rather just, you know, saying, okay, I have knee pain, so I'm just going to treat your knee. Well, what else is going on in the body? What is causing you to have knee pain? It's not necessarily that you just woke up one day and, oh, well, I have arthritis. Well, okay, what is causing you to have arthritis, you know? Like, why are your bones brittle, or why are your tendons brittle, or why do you have that back pain, or why do you feel so, you know, it's not just from how you move throughout the day or that you're sitting too long. It's some sort of underlying reason that that is causing that.
Yeah.
Something out, right? So it's
absolutely.
Yeah.
Yep. And I mean, exercise too. I mean, I remember I was working with a trainer ages ago, and she was explaining to me that a lot of people don't fully realize that if you do things like muscle building, that can improve your susceptibility to bone fractures later in life.
Bone density. Yeah. Huge.
Like I don't
Huge.
know, that's another thing Western medicine doesn't do, I've found generally, is that they're very right here, right now, and they don't help people. Like, there aren't people out there you can go to, unless it's some expensive specialist, generally, where they really help you plan for the future.
Yeah.
It's like, oh, well, if you do this habit now, then you could avoid that down the line. You know, like doctors always explore your family history. And they don't say, well, if you did this, then you'd have less of a chance of developing that. It's almost like, okay, well, if you develop that, we'll just give you prescription drugs for it. Bye. You know, like, we'll do a procedure for it.
Yeah.
But I think there's a lot of preventative care that we don't learn about.
Preventative care it's so huge. And that's again where we've shifted our mindset. So we've shifted, you know, back in the day, ancient, you know, medicine, prevention, and now it's to a place of you're waiting until disease is already in your body and then treating it.
Exactly.
It is much easier to prevent a disease and maintain that than it is to wait until you're already sick.
Yeah.
Then you're already sick. Then you're already out of balance. So yeah, I think we focus on, we just give the basics, you know, oh yeah, you should exercise more, or you should eat better. You know, that's like the prescription. And people take that and they're like, well, yeah, it's common sense, but I'm not going to do it because now I have a pill that I can take, you know, or I can just get surgery. And so that is where we've strayed.
Yeah, absolutely.
Yeah.
It
And
is.
we've strayed far because it ties into the whole world of, you know, now the fitness industry and marketing industry, and it being on, you know, a lot of times that quick fix because that's what sells, that's what makes money. So it goes back to a money thing.
Right. Yeah. Yeah, I think that is a big part of it. I think it's very easy for certain doctors to expect that you're going to be too scared to say no. You know, like I told you, I think I told you that story about the time I went to the doctor, and this was just for a wellness visit. And I had a bruised nail from running, and the doctor said, oh, this is a fungal infection. I'm going to give you these pills that you take for 12 weeks to clear the infection. And I thought, I'm just not going to fill the prescription. I mean, I didn't say that at the time. I wasn't trying to be some big rebel. I was just very confident that it was a bruise.
Right.
So it did turn out to be a bruise, which, you know, you can't, if it's something not more on the minor side like that, I do think it's good to trust yourself and what you're sensing in your own body versus
Or the
what.
fact that you stubbed your toe the day before or something and
Exactly. Exactly. Right. I'm like, I don't think this is a coincidence.
right.
You know, so it's one thing if you're, you know, experiencing chest pains or something like that and getting advised by a professional, but I think it's just another way to make money, right? It's like, oh, okay, it's a cosmetic issue. I don't think this patient's going to think twice about popping a pill for 12 weeks, probably on a
Hmm.
bunch of prescriptions anyway. So it's interesting how there's no exploration into what else could have happened to cause problems or who can really benefit long term from problems like we were talking about, like antibiotics for acne, for example. I know that works
Hmm.
really well for a lot of people who just need the short term treatment, but for
Yeah.
people who might have more hormonal problems, it's easy
Right.
for a dermatologist.
What is the acne? Yeah. What is it coming from? Like why? Right.
Yeah, right.
Yeah.
But I mean, it's good if you're doing the trial and error because then you're
Hmm.
on antibiotics for months and then you have to try something else like Accutane and that doesn't work. And then you take a second trial and that doesn't work. Like, meanwhile, that's
Hmm.
money, money, money into
Right.
pharmaceuticals. So,
Yeah. And it's interesting because I've worked, in, like I said, like Western offices, and sales reps come in all the time trying to push whatever
really?
they're selling. Yeah, so it's that's the thing too, I almost feel bad for doctors because they're being kind of hounded by pharma sales
Mm-hmm.
reps and
True. Yeah.
so yeah, it's interesting.
Oh, yeah. I remember I think this was in like the early mid aughts. Like my sisters and I would make the jokes about the Flonase and Nasonex reps. Like you go into a doctor's office for a wellness visit, they'd be like, "Oh, here, let's have some Nasonex." You
Some
know,
food sample like in the candy jar. But they would always bring free lunch, so that was good. But
oh, did they have like a table set up for everybody and they talk
oh
about?
yeah, oh yeah, get free
Oh, okay,
lunch. Yeah, like
okay. And like it's interesting
um,
too, because how does that work? Like you just the office gets a contract with the rep, and then they get a certain number of
or they
visits.
just come in, or they just walk in. I don't know. Just
Okay.
walk in sometimes, I think. Yeah. I've seen them walk into like dentist office, doctor's offices, stuff like that. Yeah.
Yeah, it's hard to know like where to draw the line sometimes, right?
Hmm.
I mean, like being just I guess as I've gotten older, has just been more mindful. Like I don't walk into a doctor's office and ever think, how are these people going to scam me today? I generally like I have
No.
a very positive attitude toward Western medicine for a large part. I think extremely highly of them, but I do understand that everything is a business. So there's always going to
Yeah.
be a pursuit of making money over maybe something alternative that could be more helpful.
Yeah. So it's about, walking into offices with an awareness of what's
Yeah.
going on. Don't just
Mm-hmm.
walk in and accept everything that's handed to you
Mm-hmm.
necessarily, literally. But it's also educating yourself because I think we have to educate ourselves because we're not being educated in the public enough about other modalities and other things that you can use
Mm-hmm.
um, to either supplement or maybe replace, what you're doing, So,
Mm-hmm.
if you are doing something and it's not working, then you have to ask yourself, okay, well, what else can I do? This isn't the
Right.
only path that I can go down, right?
Mm-hmm.
There's other paths I could take or things or combination of things that I can do to help myself. And
Mm-hmm.
I think that's where people they become kind of lost or they just become reliant and they give up their power to somebody else
Right.
necessarily without empowering themselves to make the choice or that's right for them. So yeah, you do have to do a little bit of digging for yourself and
Mm-hmm.
self-education. sometimes to get the answers you're looking for to help yourself. It depends how bad you really want to.
Yeah,
You know, if
that's
you
true.
just want to, yeah,
It's a really good point because doctors don't put anybody in a headlock. They're not bullying people into
exactly.
doing something. So I do think, and I know I've been there before, there's a lot of blind faith, right? It's like, okay, well, they're prescribing this. It must be good. Or I'm too scared to say no to this and try something else. In certain circumstances, it would have been totally safe to try something else.
Right.
So, you know,
Or
just
I don't have the patience to try something else, so
true. Yeah.
I want it now. You know, I want
Hmm.
something that's going to help me now because I'm in a lot of pain. You
Yeah.
know, so it's hard. It's hard to make a decision because it's you want to do what's right for your body, but at the same time you don't want to be in pain. Nobody wants to be in pain,
Right. Yeah.
you know. So it's you know, working in the addiction field, you know, most of the people, they weren't using drugs. Majority of them were not using drugs for recreation. They didn't start using it
Hmm.
for recreation. They started using, a lot of times, started on prescription pills, which turned to like heroin and stuff
Hmm.
because the prescription ran out and heroin's cheaper.
Hmm.
But it was all because they were in pain, and not
Hmm.
just physical pain, emotional pain, trauma.
Hmm. Yep.
And that's where it's like, okay, you're in physical pain. Here's something for your physical pain and nothing for the whatever else is going on inside.
Right.
So
Right.
that's an issue. That's a big problem.
Hmm. And
And
I'm curious.
that's
Sorry.
no, and that's what leads to a lot of people overdosing because you're
Hmm.
getting the drug out of your system and then you're going back out because you didn't fix an underlying problem, an underlying behavioral issue problem, you know,
Right.
or emotional issue. So you're using again, and then you're using the same amount that you were using before you went into like a detox center, and now
Hmm.
your system can't handle it and you end up overdosing. That's one of the biggest problems right now, and why these young kids are ODing like left
Uh,
and right, and why it's such an epidemic. So that I don't know, it's just something I feel strongly about, just
yeah.
having, you know, met with a lot of these people.
And I imagine you've seen or you've had conversations with patients about how perhaps the physical pain is so much more intense because they didn't address the trauma, and your emotions have such an impact sometimes on physical pain.
Yeah, yeah. Or that, or they're trying to wean off the drug, but the pain is still there, or the pain receptors and just the level of like they can't distinguish what what the pain is. You know what I mean? It just gets to a point where it's like been numbing it for so long. It's like they don't know how to feel stuff, or they don't know how to
Okay.
handle it. And then the
Yeah.
pain levels are just like skyrocketing because any little, you know, if you're numbing something out, you know, if you stubbed your toe and you numbed it out or whatever, and then suddenly that whatever wore off, you know, it would seem like 20 times more intense, right? Because you're so
Right.
used to like this numbing agent effect for years and years and years with something. So
Right.
that's where it's like your two now becomes a 10,
Right. Right.
you know?
Yeah.
Exactly. Does
But
anybody have any questions, comments, or any experiences or anything you want to share before we end this lovely discussion?
so such a cheery topic, I know.
Yeah.
Very interesting.
Well, it doesn't have to be like a morbid topic. It's just
Yeah.
something about, you know, it's just an awareness to educate yourself on what else is out there, and don't think in such black and white terms,
Right.
you know,
Exactly.
and that's where like our parents' generation and stuff, they didn't really know anything. Like now is a good time because you have more alternative therapies and stuff coming into the mainstream.
Hmm.
So you can integrate it more, and it's a little more accepted than,
Yep.
you know, back in the day. It was like, what was it like? What did they call it? Like voodoo medicine or whatever, right?
Hmm.
So
Oh, yeah, like witchcraft or voodoo or something.
yeah, so now you can actually find practitioners and find people who are, you know, uh, not utilizing, but practicing these modalities and
Hmm.
offering these services. So yeah, it's a good time to just yeah, educate yourself.
I agree.
Yep.
Good stuff,
Cool.
Jen. Good stuff.
Anything else before we go?
Yeah.
We're about 50 minutes in, so
Nice.
good. Well, if nobody has anything, we'll hop off.
Hmm.
So thank you, Tara. The
Thank you.
discussion
Thanks
was
a
an
lot.
interesting one.
Great insight as always.
Yes, yes. And thank you everybody who joined.
Hmm. Thanks,
And
everybody.
yeah, everybody have a good Thanksgiving who celebrates, and we'll see you next time.
Yeah. Bye,
So,
everybody.
all right, take care. Thank
Bye.
you.